By the way, we got plenty of stuff to go through, so we might as well just start, huh? And back to the Zoom. Good morning, everyone. This is week 2. So last week we went through all the small stuff, and this week we're going to start tackling muscles and bones, my favorite topic. So be aware of that. Strap down your seatbelts. It's definitely a ride. You're going through a lot of stuff. I've graded a bunch of things. I didn't really look at the quiz scores yet, but that's a lot of busy work, so you can take those over and over again. So I assume those scores are pretty high. Yeah, that's about it from that perspective. Just make sure you don't fall behind too much because it is going quite fast. Who is not?
For the quizzes?
Oh, Janie, hi.
For the quizzes, if I decided to take it again, is it deducted 1%? I mean, I already did it, but I wanted to see if I could get a higher score.
I don't think if you taken it the first time before the due date, it will do that. But if it does, let me know. And then, you know, we'll address it. I mean, again, if the late stuff gets, you know, into the way at the end for like a grade change because of that, we're going to take those things out. This is just particularly, I'm doing the late percentage penalty for that gives you a little more oomph to stay on target with the due dates. Once I started implementing them, a lot of the students just were much more on top of it. And so it's not meant to be a punishment from that perspective. And again, if, you know, because of the late, you get a B versus an A, well, guess what? You get an A, and we'll make sure at the end we take that all into consideration. The thing is that the thing I cannot change, there's no lates to that, is at the end of the class. That's when it finishes and everybody has to finish, including myself. There's not much I can do about that. Good. Does that make sense? Yeah, I guess so. Yeah, and the other thing is in Zoom, the rule is just speak into me. Don't have to raise your hand or anything. If you have a question that comes up, just raise the question. I wanted to do a couple of general points in terms of the discussion. When I grade the discussion, I have 3 parts to the discussion forums that I'm interested in. The first is your first comment or your first post. And then I want you to read a few things, a couple of students, 3 or so. I think it's 2+. And then you reply back to them and say like, hey, that was a good post. I like how you do this, or maybe it wasn't quite complete on that topic. When I learn how to grade online classes and critique instructors, they talk about the envelope method. So first you do a praise to the person that they did a good job in something. And then if you have a critique, you critique the post, not the person. And then you finish up and give them a pathway for like how to make it better, if you can. So that's kind of like how we can be somewhat critical, because it's hard for us to take criticism, a lot of us. And we can also, as being the replier, learn how to do positive reinforcement kind of criticism. And so make sure if you only got A points, for example, you haven't responded back to a reply. And I reply to every post. And so I can assume you at least respond back to my post if you haven't gotten anybody else's, because that way, it's not like the reason why I do that, or why some of us do that, is because if you read a post and then somebody responds but replies back to you, but then they never read it again, it's like, come on, really? I want to close the circle and say like, oh, thank you for mentioning that. That really helped me understand my situation better. And so that's why I make sure we feedback. And these scores are dynamic, meaning they're not like, oh, you got 8 out of 10 and then that's what's in the books. I go back over and over and look at them and add on the points. Or you can text me out and say like, hey, I did another thing. I did this. Can you update my score? And I'll go in right away and do that as well. So I take it from both ends that we don't miss these. And if nobody, well, no, actually, I respond to every post at this point. So everybody has something to respond back to. So don't be too alarmed if you only get 8 out of 10. That's because of that. If you get 5 out of 10, that just means you didn't reply to nobody. You just posted and that was it. And so then that's a bit more of where I urge you to go read other people's posts, especially, for example, if you don't understand an exercise or you don't understand a question. Once you post the first, you then can read everybody else's post. And that's how also the learning process happens. That's how you can understand the topic better if it's a challenging one, and or also understand how the exercise works as a whole.
Professor.
Yes.
In previous classes, in anthropology class, there was a lot of same discussion boards that we had to answer, blah, blah, blah. I had access to a discussion tab on the side, which was make it a lot easier to find all those conversations. I think it's something you can unlock and unlock. From our point of view, we see home announcement, module grades, people, blah, 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 but there was like a discussion tab on the left side that had all the discussions, and it's a lot easier for the student to access it.
Oh, okay, let me open that. Yeah, I know.
Does that make sense?
Yeah, I know what you mean.
I could share my screen to show you if you want for a second.
No, I know where it's at. I got it. I can actually do that right.
And it's like from the even from our phone, like to find back those discussions in order of which they are.
Yeah. No, I get exactly what you mean. Let me do that real quick. That way we can make sure it's happening. Hold on. Should leave students. Yeah, see, it's on mine. It's here, right?
Yeah, it's on top in that discussion one that has
right here, right?
Yeah, this one. Yes. Correct.
Okay, let me open that. I closed it because I don't want to have to see all of them.
But that's the one, if we get a grade on it, it's so much easier to access from us from the phone.
Yeah, no,
and from the
That's perfect. You're telling me that. Thank you so much.
There you go. It's right there.
Yeah, there we go. So let's see. Enable. Did I take it? There we go. And now we can put it up to modules right there. That way it's right there. And then save. And then if you can double check and see if it took it, maybe it takes a minute, I'm not sure, or refresh.
Oh no, it's right there. It's working.
Oh, perfect. So that's good.
Oh yeah, that's so much easier.
Yeah, you know, you brought up a good point too in the Padlets, which I did not. First it was like, oh, let's leave the Padlets anonymous because, and I'm like, once you mentioned, I'm like, why the heck should we do that? Because it's not like we have to be afraid of each other. And so if you go to the Padlet, I would like for you guys to go and export it. And then once you export it, you see my screen, right?
Yep.
Once you export
login.
Okay,
click the login button.
The log in, and you go log in there, and you can use your, you can use your Peralta login, and that gives you direct into it, and then your post will have a name on top, so it's not just anonymous. And so if you could do that, everybody, that would be great, because then we can talk to each other with real names, and we're not just anonymous and they have to give each other a number or something. So if you guys could do that, that would be great. And that way it becomes more personal, because the Padlet to me is actually a very important tool, especially now that week 2, 4, and forward, we don't have discussion forums. It's more individual work. So the Padlet becomes a very good place where we can have these conversations with each other. And again, of course, if ever you have a question, you just text me at 510-387-2946, and I'll be as right there as possible as I can. Emails work too, but it can take me a day or plus, because I don't always go in every day. I have work days at the office, and then I don't go do the grading stuff for those days. So if you want me, feel free to text me up. Don't hesitate. Yes.
Just to be clear, we as students are to reply to 2 other peers per discussion. So we need to comment on 2 peers for the chemistry one, 2 comments on the anatomy one, and okay, I just wanted to make sure. And then any responses that we then get.
And then if you get a reply, you respond back to that. Like,
perfect.
And you can say, I'm not going to grade you if you say like, hey, this question, I didn't get this question. This was really hard for me. And can somebody help me understand? And actually, you're going to get somebody who knows it and can understand it better, or has a way of explaining it, because it also gives me the opportunity to not have to be the only one explaining things.
Yeah,
I might not do a good job, or I might miss something because I've been out of the school system for too long, and I might miss a point or something. And so,
does anyone know if we can get notifications? Because like I'm looking
No,
at,
I've tried it. It doesn't work. I've tried in my
Okay.
previous. I mean,
it's
that
like
I know
I
of.
missed a reply, but someone replied to me on a Saturday. Like I
Yeah,
was done
yeah.
with everything
You can get
on the
a
weekend.
summary.
So
You can get a summary email of everything that's happened, but you're
It
easy
would be
better
a
off
lot.
going back to the discussion board and looking through
Gotcha.
that.
Well,
Okay.
and
now that it's available on with one of the tabs from your phone, you can check it pretty easily. You can check it easily from your phone now that there's a discussion tab. Before you had to go to
Okay.
module, find the one, open the right
Yes.
one. Like it's I've had that in
No, I just
anthropology
looked
last
it
year.
up on discussions and it's
Yeah.
a lot easier now,
Yeah.
but I'm
So
looking at when the responses came in and I was not.
It
Well,
will tell you.
more than I could put.
go ahead, Rafael.
Sorry, it will tell you. Can you okay if I share my screen for a second?
Yeah, if you can, let me make
Yeah, of course I
sure.
can. I can.
Yeah, if I enabled it.
This
Multiple. Oh yeah, you got it. Okay, perfect.
here on the side here, you have your unread reply. So if you go, let's say I do the same as you on Saturday and Sunday. I'm at work, so I work from Monday to whatever it's Wednesday. So on Monday you'll go in, you'll open it, whatever the day, you'll have to scroll down and read everyone. Okay, cool. Once I'll read everyone, and then when you go back, it shows the count shows as 0 here. So you know if there's a new post or not, without having to go all the way in. You still have to manually go and check. You won't get, I mean, I couldn't find a way to get notification. But if you read them all once on your Friday, or let's say on your Thursday, you've been through the whole forum once, then when you check again on Friday, the count here should say 0. And then you
Gotcha.
know if someone else has posted. That's the best way I found in anthropology last year to do it and to keep up to date with it.
And then Angela, another thing is too, I since I'm doing the grading, I'm looking at them, and if you, let's say you only got 8 out of 10, it's like, oops, maybe I should go check. And then you check, and then I get a post, and then you get 10 out of 10.
Oh, perfect. Okay.
So you know, and
Makes
I
sense, yeah.
mean, and
That's
it's
helpful.
all like, you know, it's not all exact. You know, it's like if you got
Sure.
3 posts and you respond back to 1 or 2, it's like, you know, I see that you try your best, and then that's fine with me. You know,
Do you mean that you want us to have a conversation or something?
well, of course it's nice to have a
I'm joking.
conversation, but I
I'm
also don't want, you know, I also don't want people to take their time and go like, let me help them out, and then they never go look, you know, and it's like, then they don't learn the point, you know, so it's like, it's a little bit of closing the loop thing, you know. Anyway, but hopefully that clears up things a little bit in terms of your points. If again, if you don't get the full value, if it's 8 out of 10 on those discussions, you probably haven't responded, or maybe you haven't had anything to respond to. And then now that I respond to everybody, at least you can say, hey, thanks, or something. That way we know it's closing the loop. And just do the best you can. And it's dynamic that way. So do not think if you only get 5 out of 10 and I graded it, that's it. The test is done. Don't think that. It's a dynamic thing. Okay.
For the test, so the weekly test, so I guess we can call it our weekly exam, the big test, the one that has 1 attempt. We have the test is open. For example, for week 2, test is open somewhere now, I guess, somewhere during those days. But we have
no, but I can open it, Rafael. I asked this test, the first test you asked me to open it sooner, right? Oh, you asked why, I mean, so I open it.
My question is, I wanted to see my answer to see what I got wrong, and I will have access for week 1. So, and understand what I got wrong. It doesn't, where I'm going is it will close at the due date of the test, which is this Sunday. We have two weeks to do the test for each week, correct?
I gave you 1 week, but I have no problem giving you 2 weeks, because if you work,
no, I don't want 2 weeks. I don't want 2 weeks. I want to have access. The more time, the later the due date, the later the closing of the assignment is, the later we have access to the correct answers, therefore to be able to understand what we got wrong, if that makes any sense. Yes.
Let me ask you 2 questions. The first, you at this point, until the due date is happening, you do have access to the answers?
I do not.
You do not. Okay, so I need to make sure I give you access, although I'm not sure I want to do that.
Yes, you don't, because technically that would allow me to give it to someone else.
Yeah, no, you're right. I don't want to do that. But the due date will be a hard due date, because that one is a hard due date, because I don't want people getting way behind. I have no problem opening it sooner, but I'm not going to keep it later.
Yes, so the due date is always week 2.
If it comes push to shove, I can give it a couple more extra days, but I'm going to keep that due date as a hard due date to this point.
So for test 1, for example, the due date is on the 26th, right?
Yeah.
It's week plus 1. So if the test for week 1 is at the due date is at the end of week 2, correct?
That's correct.
Wonderful. Okay. No, that makes
And I do the same with the other
that makes
one.
sense. I don't want it
Other
sooner.
ones.
I'm just
But I can, well, you don't, you know, you can take it
we
whenever.
want time. Yeah, of course. If something happened, we want time to do it. I'm not. Yeah.
But at least that way people have time. But what I will do is I will open test 2 or test 1. I opened mid last week after you talked to me about it.
Yeah.
And test 2, I will also open now mid this week in case some people who work fast or want to move ahead, they have that possibility.
So but we'll be able to see the correct answers and to correct ourselves only at the end. Yeah, but that's the way there's no changing.
Yeah,
Okay.
unfortunately with these
It's
tests,
just the way it is. It's fine.
that's a problem because I ain't gonna make these tests over and over.
No, it's completely
Work,
understandable.
you know?
Yeah.
But if you have individual questions, I have no problem. Text me and I can go look real quick and say, hey, that was the answer and that was the answer. On an individual basis, no problem. I could see it in the background.
Yeah, but I don't even know. But it's fine.
No,
It's
but
like
I can tell you, but I can go look and tell you.
well, it doesn't. I don't. It's more of a. It doesn't. It's all good. All good.
Okay. But if anybody has that desire, reach out. We'll make sure you get the answer and I can explain you why this answer or that answer as well. Let me though share. Let's go right into that though, since we're at it. Let's go right into and again, if you have questions, just talk to me. Don't have to raise your hand. But if you go right back into the test 1, because that opens now. And so I want to just reiterate, we did it last week too, but I want to make sure you understand you have a test review. And in the test review, you have all the main concepts listed by category or by chapter of what is expected of you on the test. So if you understand these bullet points, you're good for the test. Also, you can take it and print it out. So you can have, it's open book. My tests are all open book. This is wrong here with the number, you have more time, but these are all the things that are then, you know, in the Canvas tabs as well. And you could print that one out and then just have it as a guideline when you take the test that way. And you have 120 minutes, I think, or did I even give you more? I don't remember. But you should have plenty of time for that. And so make sure you do go through this review tab. And if you can print this out in addition to your notes before you take the test, because it potentially will help you with taking the test. And so I want to just say that over and over. Yeah, 2 hours you go. And so that's for test 1. And if you good with that, then I want to just go right to test 2. Because what we have now coming up this week is muscles and bones. And when it comes to muscles and bones, we have obviously a lot of lecturing, we have questions, and then we have a lot more labeling exercises. And the labeling exercises, we start with the skull, and in each exercise, we have, of course, an overview, a purpose, blah, blah, blah. Then you have a tab here where you can click on and you can print out a picture of the exercise. That's this picture that would you print out. Or you don't have to do that. You can also use this, like in the first chapter, we had that, this annotation device here, and you can do it online and then just upload it online. Each of these chapters will have videos that explain the terms that I'm going through. Some of them are from Bio24. Some of them are also still from Bio2, which I taught before Bio24 a long time ago. And what I want you to do is I want you to take all of these terms and label them on the picture and also color the area of the picture that they pertain to. And so it's sort of a labeling and then a coloring thing. And you go through all of those terms. In the videos, you might have a few extra terms that I mentioned, or maybe a couple might be missing, but they should be as complete as possible. And it just takes a long time to make these videos. So I'm not going to be able to redo them too many times. And so once you've done that, once you label and color all the terms, you upload it, and that is basically your lab that you're responsible for. We also have some labs in there that have questions with them. I think the axial skeleton has some, but for sure we have the extremity muscles, and I think the trunk muscles also. So let me see if I can open that real quick in a picture. And when you look at that, you see you have muscles and you have, sorry, I'm jumping around. Maybe make sure if you get a little whiplash from me jumping around so much. You have all the muscles listed here that I want you to label and color. And also that I want you to then in here, like this is the serratus anterior. So you color that, you indicate what's that. And then here you have an O, an I, and an A. And those are, once you start getting to the material, the O stands for origin, which is a muscle attachment on the bone. The I stands for insertion, which is another muscle attachment on the bone. And the A stands for action, which is what does the muscle do when it contracts. Muscle tissue simply shortens and contracts, and then it moves bones around, or sometimes skin, like if you look at the facial muscle, it makes faces. Those are also muscle contractions that do that. And that's what I wanted to indicate here on these. So I want you to go, when you go through the material, let's go through the material of this lower extremity real quick, just to show you how it's structured, or upper extremity, I guess. When you look at the tabs there at the main points after the videos, you see how I list here different muscles, and then I list the origin. What is the, and I have some, of course, some abbreviations that you're learning. The TP stands for transverse process. That's a part of the spine here. The spinous thing, you learn that as you go through the skeletal system. The insertion is the medial border. See, now you need to learn about, that's why you learn something like medial and lateral. Medial means something closer to the spine. Lateral would mean something further away from the spine. So we start utilizing those terms in the text as well. And then the action is it elevates, it raises up the scapula for this muscle, for example, and it rotates a part of the scapula that you will learn what this part is called in the appendicular skeleton. And so that's how I list these bullet points. Also in these bullet points, for each muscle, or almost each muscle, I laid behind cadaver videos that I created. Well, I didn't create those, but it came from a big source that I chopped up and did all kind of things. And now you got like 15 seconds, for example, that explains this muscle.
Arises here on the outermost point of the first three cervical vertebrae.
So it helps you really visualize the muscle. If you can handle, you know, bony stuff and little muscly stuff, then you go
elevate the scapula.
And so that's what I've done. That's what I've done there, and I listed all of those here as external links. And every muscle should have one of those. So these are actually quite helpful to visualize it. Maybe not everybody feels like that, but a lot of us get helped with that. And I also put a link to the video clips of the cadaver here that goes to a Dropbox account that has all of those in one thing and has a little catalog, which muscle is what. So you can also access it through that part. The other thing I provide you in terms of studying muscles, not bones here, this is muscles, I provide you with pictures that you can make flashcards with. And so I didn't make that either, but I got a handle of some of that stuff once, and every picture here has a muscle indicated that you can cut out, paste on a card, and then label or color, or just use the sheets to like test yourself and so forth. So that's another thing that I think it would be great to utilize depending on what your study preferences are or so forth, you know. And then I created this for myself because I work with a lot of patients, and this is good for an electronic device. This is my favorite muscle picture. On this picture, I have pretty much every muscle that you will probably most likely ever need to know listed. And of course, my handwriting is here, so it's not that easy, but you have it really well visualized where the trapezius starts, where it ends, and where the fibers go. And so I really like this picture very much. And I created it for electronic devices because then you can zoom in as I just did. And if you print it out, it might be a little small. But that's, I figured, let me just put this behind as well. Maybe some of you find some interest in that. You know, I'm a massage therapist, so, you know, guess what? find a lot of joy in these muscle things. So whatever I can share and helps you guys to potentially helps you guys to, I want to share. That doesn't mean everybody has to use it. That just means it's there for you if you feel like it's helpful. All right, any questions so far? A silence I take for a no.
Looks good.
Yeah, oh, good. So, again, just butt in if you have questions, because let's go through the lectures a little bit. So the first part that we're talking about is the skull. And when we look at the skull, we're gonna look at basically skull bones or cranial bones that form the head, which is where the underneath the brain is. And then we also have facial bones, and that's what creates the face. And so these are the two differences that we have when we look at the skull as a whole. And here they are all listed here, and then as an overview, and then we go through each individual bone. And for example, the frontal bone, guess what? That's in the front of the head. So that's pretty easy to remember. So that's good. Then I have a few points of what it is and what are sort of the landmarks. When I look at a test 2, test 2 is made in a way that, let me show you real quick of how I make this, because I'm asking you terms. Oh, one thing I forgot to tell you, when you look at the test review, you actually have a tab here. In the test review, you have a tab here. Wait, that's the wrong one. Shoot, sorry about that. I'm confusing myself with all these tabs. Test 2 is here. So in the review on test 2, you have a list of all the testable terms on one sheet of paper. So all the labeling, coloring exercise terms in the individual exercises are here on one list. And so you have the bones first, and then you have the muscles here. And so if you print this out, that gives you a very good overview of all the terms you need to know. Anatomy has tons of more terms than that. This is scratching the surface in some ways, but it's still deep enough. Everything else, a lot of other stuff you can just look up, and it's hard to remember anyway. And so, but on the test, all the terms I'm using are on this list. There's no more terms. You don't have to worry, oh my God, what else is? It's not like anything in the book. It's just those specific terms I want you to know. And so I have that list here under the review material, test 2 review. And then the second tab I have there are videos that I made that go through all the terms on the models, because when we're in the classroom, this is a place where we have the models on the table and you're looking at it and we go through the terms together. And here we just have to sort of trying to create that virtually and still be sort of in touch as much as possible with the physical part. And so this review videos, I don't know, they're like 10 minutes a piece or something, go through all the terms that you need to know for the test. And it shows it on the models that are going to be used in the test. Because when I go through the test here, let me just preview so you get a little taste of how that's going to look. I know it's far ahead. It's not test 1, this is test 2, but I want to go through it now anyway. So on the test 2, I ask you to, I label a part of a bone, and I have a video that I indicated that I show it. I have a picture and then a video, and then an external link to a video. And then you have to type in or copy from the list, the term list, the term that most likely fits this thing. And so the first here is right here. And there's 1 to 54, I believe, that I want you to do that with. And so here, this one, you have to actually type it in and copy it in. And so that makes it a little bit more challenging than just picking it up from a multiple choice test or quiz. And also what I do is I ask you for 3 different things. I ask you for a bone. So if I say, what's this bone? You will call it the frontal bone. We just looked at that briefly. But then I also ask you for landmarks. And landmarks are the smaller parts on that bone. So here, that in between the eyebrow part, what is that part called on that bone. So that's what I'm asking you there. And then you write that landmark down. So you don't just give me the bone when I ask for landmark, you give me the specific area. And then the third thing I ask you is muscle. And all you have to do is label the muscle. You don't have to know the attachments on the bone of the muscle or the actions on the bone of the muscle. We don't go into that. Or in a higher end class, you actually even learn the nerve supply of the muscle. And we don't even talk about that, because to me, it just gets very overwhelming personally, because I have my own ADD problems, and or not problems, is actually not a problem to have if it's managed properly, but it gets overwhelming. And so I don't even want to worry about that. We can do that as a second part in a second learning cycle. So that's the way the test is built. And then let me go one more time into the review, because I have a third tab here, and the third tab in the review are pictures, and there's an external link, are pictures of the models that I use on the test. So there are most of them. In the beginning of the pandemic, I went into the school and took all these pictures and videos. And so I have maybe not all the views on it, but I have all the models that the test will come from. And so this is a good one to download or to have open and test yourself. If ink is not a problem, just, you know, print it out. If ink is an issue, then it might take a little too much ink, because these are photographs. But this shows you the models that are used on that test. And so you can really familiarize yourself with those. And so then it's not just foreign when you get to doing the test. That makes sense so far?
It does.
Good. Then let's just go back into the tab. So we had the skull, where we basically talk first, we talk through all the, all the bones and the bony parts of this calvarium. That's a pretty good long list with pictures. And again, if you know, these are great things to make your own Google image searches with, and look at different images. I can only on Canvas, I can only post pictures that are a common source. You find these pictures in the textbook that I recommend at the end of, if you want to know more. That's a textbook that's free to get online. You just can watch it. And so I can only list those pictures from there. So I'm a little limited in my booklets, and they're very visual. Those are all kind of pictures to visualize the stuff that I found online. And then lastly, in this chapter, we go through the facial bones, and we just talk about, you know, the upper lip bone, the maxilla, and then we have, you know, we have the nose bone, lacrimal bone, we have zygomatic, the cheekbone, and then we have some flaps inside our nose that are called turbinates, because they create a circular motion with the air when we breathe in, and that helps the air get clean, get warm, get moistened, all of that. And so that's one of those bones. It's pretty interesting stuff. And again, I'm lecturing on that as well in the videos. So that's what covers the skull, basically. And then when we go to the next one, we go to the facial muscles. And the facial muscles, we cover not all the muscles, especially we might cover some more muscles in the lecture, but we don't cover all the muscles when it comes to labeling. So make sure you look at that list. But it's an interesting chapter. This chapter I created all on my own, where I'm talking first about facial expressions. Why is it important? Why are facial muscles important? And then we're gonna have a little tab on overview, because we get into muscles that talks about the origin and the insertion, the attachments. So when you look at attachments, the origin of a muscle is the attachment that stays stable when the muscle contracts. And so if you look at your biceps, for example, you know, you curl your arm, your elbow, your forearm up, the shoulder attachment of the muscles in the anterior part of the upper arm, which pull the forearm into it and flex that elbow, that is the origin, because that part doesn't move, it stays stable. And the forearm part is where the insertion is, where the muscle attaches to the forearm bones, and that part moves and bends the elbow that way. And so that's called the insertion. And so that's the difference between those two terms. Sometimes, depending, you know, you could argue that an origin and an insertion flip. So if, for example, if you lift your leg, you have a muscle in the front of your leg called the iliopsoas, or the psoas muscle. And there's an interesting one because it gives you a sore ass. And so that's how I teach it. But that muscle has its origin when you lift the leg in the deep anterior part of the spine and the inside part of the pelvis, and then the insertion on the thigh. But if you were to do a sit-up, for example, and the thigh is stable, then the thigh is the stable and the trunk is the one that moves upward. And so sometimes it's not like put in stone completely. It can change, but the definitions are right here, and the definitions are what's important. Again, that's, you know, a little bit further out. For us, we have an origin and insertion, and then the action is what does the muscle do when it contracts. Innervation we don't talk about much because that gets very nitty-gritty in the neurology, and it just gets overwhelming for me. And I figured for the students too at that point. And then we go into the different muscles that create facial expressions, like all the ones that make us smile and frown and all that stuff. So we have a bunch of these muscles. Those are really cool names. And when you look at muscle names, you gotta like be slow and deliberate and try to understand what the heck does that mean? Because, like, for example, if you look at an orbicularis oculi, or oris is easier, but you might recognize the word oculus is sort of a round ball. So that refers to the eye itself, the eyeball. And orbicularis, an orb is a round structure, and that means it's a round muscle around the eye. We also have an orbicularis oris muscle, and oris is mouth, right? So that's the muscle around the mouth. Or another term here, for example, levator palpebrae superioris. Levator means elevating something. So that word comes back all the time. Muscle names are often named by action. What is the action? So it elevates something. And then, you know, palpebrae, you might not know that, but you will learn that. That means eyelid. And superioris means above. So you have an eyelid muscle that pulls the eyelid up. That's the main one. That's the levator palpebrae superioris. But you also have one in the inferior part. And so that would be logically then, or ideally called levator palpebrae inferioris. Or this is cool too, the levator labii superioris aliquinasi. That's probably the longest muscle name we got. And that one is not on the test, but it's the nickname is the Elvis muscle, because you basically lift your upper lip up a little bit and wrinkles the nose a little bit. And so levator, again, lift something up. Labii is lip. Superioris means above. Aliqui means wing, actually. And nasi means nose. And so a lot of these terms, if you actually space out on them a little bit and go with visualizing and don't just read over it, you can make up a lot of what they do. So that's kind of, I think that's kind of cool, but I'm a little nerdy on this stuff. So just be a little nerdy for a week and then we can get over it. Then we also have in the face, we have muscles of chewing. Mastication means chewing. So those muscles are not attached to skin. The muscles attached to skin do facial expressions. They move the skin around. Those muscles move the jaw around. And so those are 4 of them are chewing muscles. And the main ones we have are on the side of the jaw. So they attach to the cheekbone and then into the lower angle of the jaw. And then one other one goes actually from when you look at the lower cheekbone, the mandible, you have a main part, and then you have a little thing that goes up right around here. You can't see that, that's on the skull. But that muscle, the temporalis, goes all the way up to the temple area of the skull, and that then closes the cheek too. So you have a muscle that closes the cheek, the lower jaw, the mouth this way, and one that closes it this way, which gives you pretty good strength and force in different angles. And then we also have a couple of small ones, and those are known as the pterygoid muscles. We don't test on those. Those are really hard to understand because they're so deep in, and it makes it hard to visualize when you just can't see it. But one of the pterygoid, it's interesting, is attached. It's like the outside muscle that when you clench your teeth, you can feel a little bulge on the side of the jaw. and you also have that same kind of muscle on the inside. So it's almost like the jaw is a sandwich. The bone is a sandwich, and on the outside and on the inside, we have muscle that covers it. And so you go through those 4 muscles and then get a better understanding of that. And then that covers the facial muscles. And then from there, we go into the axial and the appendicular skeleton. And the axial, oh, we also talk about joints here as well. We have to do a little bit of joints. Sorry, I spaced that out. We have to do a little bit of joints because we have different joints in the body. The ones that we think about are the elbow joints or the knee joints or the ones that move, the shoulder joints. But we also have joints, for example, in the rib cage in the front between the breastbone and the ribs. And those, they don't move much, but they move a little bit. Those are cartilaginous. They're cartilage that covers those joints, and they have a little bit of motion. And then we have joints like the teeth fitting into the jaw. Those are joints too, but they better don't move. They better be solid. And so we have some joints that are immovable, some joints have limited mobility, and some joints, they are freely movable. Between the skull plates, the reason why we have skull plates is, yeah, we think they're fused, but we actually have jagged ridges between the few of the plates. And that means they move a little bit, and they move very, very little. Those are slightly movable joints, and they actually help the dynamic for the brain to breathe, because they help secrete a fluid called the cerebrospinal fluid that surrounds the brain. It nourishes the brain, gives it glucose, for example, sugar stuff, and is also good to flush out the brain, which have shown to create a little bit less of an Alzheimer situation when in the night, when our cells contract a little bit, and they can be flushed out and cleaned up a little that way. So they're working on that, I believe, right now. And so those sutures, they're called sutures, they're also joints, but they're very immovable or very slightly movable. And so we talk about that. We go through the types of joints. Well, then we go through oh, here, there's pictures of these. I should have shown that. So they talk about the types, or even look, even as a kid, when we grow and our long bones, this is an arm bone, for example, or a generic bone, but it looks like an arm bone, the top of an arm bone. When that bone needs to move because the kid's bones are smaller than our bones, then we have a little cartilage between the shaft, the mid part of the bone, and the end part, and that cartilage is where the bone grows. And you've learned that in the tissue chapter a little bit. And so that actually, technically speaking, is a joint, even though we don't consider that in our regular language. But let's say, for God forbid, you break that thing and you still have growing potential going on, and to disrupt this area in a child, you have to be very, very careful, especially if it's in a leg, for example. You break one leg and not the other, and then all of a sudden, this area where the bone grows in length is disrupted. And that means one leg might be not as long as the other. So you have to be very, very careful with that. So that's where those things become clinically important. And then we go right into the synovial joint, which is that freely movable joint. And that's the one we talk more about. Has a few parts to it. It has a cartilage at the end that, you know, that when when we get older and we have knee arthritis and it grinds and hurts when we walk, well, that's the cartilage is not as good then. But, you know, some of building cartilage is when we walk around, when we actually stress it a little bit and we move it. We don't damage it. We don't, you know, go crazy and jumping off of buildings. But when we move it, we squeeze the cartilage a little bit, and then it exchanges the fluid that way, because cartilage cannot have blood supply. Because if you have blood supply going to a joint, you can only visualize how much bleeding you always get when that thing moves and rubs over a blood vessel. And so we exchange fluid by, it's called imbibition, by movement, by squeezing it and then unsqueezing it. So it's a little bit like a sponge that way. And so that's an important portion. That's also good to understand that, because guess what? If you're a lifelong couch potato and then you're 60 and you can't move, well, guess what? You haven't used it. And there is this saying, so if you don't use it, you lose it. And there's some truth to that. Then every joint that is a so-called a synovial joint, a freely movable joint, has, and by the way, these terms here, they're not on the test. So just use those diarthrosis, and so use those to understand it, or, you know, make your own booklets. And next time when you take an upper anatomy class, if it comes back, you're like, oh, I heard this term before. And then you can plug it in where it's at. But you also have fluid in between these joints. It's called synovial fluid, synovial joint, synovial fluid. And that means we have to have a skin sort of around the joint that holds all that fluid in and together and doesn't make it leak. And so that's what that is, the articular capsule, they call that. Articulation is a word that means joint. You know, one book to get if you're interested in this terminology stuff, there's these, well, I don't know, I don't even have it anymore, but there's a small little skinny book with medical terminology or prefixes and suffixes. And that's a really good booklet to have, or, you know, use the internet to look it up. But the more you understand these words, what does ARTH mean? That means joint. Then you know, oh, I got arthritis. Well, that's probably something in the joint. And then when you also know an itis, whenever you see an itis in the end, you know it's an inflammation. It's like, oh, that's probably something like an inflammation in the joint somehow. And that gets you further along in understanding what's going on. Because like I often get patients in the office and they're, you know, in their 50s and to go to the doctor, they have neck pain and they take an X-ray and the doctor says, well, you got arthritis. That's your problem. And here's a pill. And maybe, you know, but it's like, okay, good, I got arthritis. So what am I going to do about it? They don't talk about that. So the more you understand, the more these kind of questions come up and the more you can, you know, help yourself get better medical attention because you're actually asking questions, which is a very important part. You know, the doctors are also human beings. If you don't ask questions, they can tell you stuff, but they're not just always tell you. They might not even know that you understand anything because maybe you don't. And so you know, you got to be your own advocate, I think. And the main reason why I teach this class is because I want to make people be better advocates for themselves. Anyway, then the other thing we have in joints, we have ligaments, and ligaments are bands that are like rubber bands. I visualize they're like rubber bands, and they hold the joint together and in different movements. And so they limit motion that we don't damage the joints. And so those are ligaments. The other thing that comes up as a term often is tendons, and tendons are the ends of muscles, the white stuff from the muscle. That's a tendon. So ligaments span from bone to bone, helping the joint be protected. So if you twist your ankle, for example, and you tear those ligaments, you're going to have a little bit of a wobbly ankle. It's not as well protected. And then in that situation, the muscles can come in and they can help protect that. But of course, it's a lot of work and it creates muscle soreness, especially if you have a twisted ankle on the outside of the calf. You get muscle soreness because there is muscles in there that run by the fibula, the fibularis muscles, that stabilize the ankle, what a ligament can't do if it's torn or if it's overstretched. And so those are interesting things to learn. And so a ligament is a bone-to-bone connection, and a tendon is a muscle-to-bone connection. And so it's the one that anchors the muscle into the bone. And then we got a whole bunch of different synovial joints based on the motion. So, you know, you see like an elbow, you can basically move up and down, and then you can flip a forearm down and up. And so there's a fairly limited amount of motion that you can have. Or a shoulder joint is moving in all different, or a hip joint moving in all different directions. And so that's a different type of joint. It's just how does the joint surfaces, and then how do the ligaments allow movement, and of course we're talking about, you know, healthy movement, not pathological movements here when things are broken. So you go through some of those, and then what else we got? There's the explanation, and then I think after that, we have to talk a little bit about joint mechanics. We have different motions. Sorry about that. We have the biggest ones that we look at is flexion extension. So flexion is when you close an angle, when you bend an elbow. Extension is when you bring it back out, when you stretch it out, or in, you know, you can see it in the knee here, flexion and then extension. Or in the shoulder, you have flexion. That's a little bit harder to understand, but flexion and then extension, bringing it back. Then you also have, so that's the big one, flexion extension. You also have this funky thing called abduction and adduction. And I list them up here. So abduction, and so the only difference in these two words is the second letter, the AB or the AD. So abduction is when we take a limb and we move it further away from the midline. So like we take a limb and we move it outward. That's abduction. adduction is the opposite when we bring a limb back to the midline. And so the way I remember that, as silly as it can be, adding, ADD is a word in adding. So I'm adding something back to the body. So I'm bringing the limb back to the body. So that's, I visualize that as adding. And so then I know abduction is the opposite of that. So that's probably the most frustrating one from a term, because it's like they couldn't really come up with a different term. Nope, they didn't. And then we have rotation. We have an internal rotation, external rotation. So if you turn your arm, you have your palms forward and you turn the palms to the back, that's an internal rotation. So you turn inward. And then if you bring the arm back out, that's external rotation because you turn outward. So those are kind of cool. And then we have a few specific ones. So we have pronation and supination, and that's specifically in the hand. Pronation is palm down, supination is palm up. And I remember that by, if I want to hold a bowl of soup in my hand, I better supinate my hand. And that's how I remember it. Again, silly, but it works. It's been staying with me for 20 years. I'm good with it. Another one is that's happening in the ankle is dorsiflexion and plantar flexion. This could be like flexion extension, but for some reason they didn't make it as flexion extension. So dorsiflexion means when we bring the toes up, plantar flexion is the toes down. And I remember that by I'm planting my foot into the ground, as in plantar flexion. So that's pretty simple. And then I know I should go to the garden and water my plants afterwards. We also have inversion and eversion. That's also in the ankle. Inversion is bringing the sole of the foot inward towards the midline. Eversion, and most of the sprains are inversion sprains, and that's where that term comes from, because you twist your ankle that way. Eversion is the other way. You bring the foot to the outside, you evert it. We don't really talk much about those, but I need you to go through them. Well, actually, if you look at the feet muscles, then we will talk about those, or the calf muscles. Mostly what happens in the feet is the muscles are in the calf. Most of what happens in the hand, the muscles are in the forearm. What happens in the elbows, the muscles are in the upper arm, and so forth. And then we have one more, and that's we are, as humans, we have this uniqueness that we share with the raccoons, I guess. And these are opposable thumbs, which is actually very, very important if you look at, our development as a human species, because if you don't have opposable thumbs, it's really hard to grasp things and hold things. Ask a dog to hold a hammer. It's really difficult for a dog with one hand. And so the opposition means when we bring the thumb to the fingers, when you bring the thumb into the hand, and the reposition is the opposite. But we usually use the word opposition, oppositional thumbs. All right, so those are sort of the joint dynamic terms, and then we go right into the axial skeleton. And so when we look at the skeleton, we differentiate between axial and appendicular. Axial is the core, which is the skull, the spinal column, the rib cage, and then the sacrum down there. And then the appendicular skeleton. Do I have that here? Overview, let's see. No. I thought I had some picture on that. Well, too bad. And the appendicular skeleton is anything from the clavicle, the collarbone, and the shoulder blade out in the arm. So the appendages, that's where the term comes from. The axis is because, that's an axis. It's a longitudinal axis, but it's still an axis. And I visualize an axle in a car. I just have to turn a spine upside down, and then it could become an axis. And so that's why we talk about it as axial skeleton, and the appendicular are the appendages. And so in the hip, it will be the pelvis, and then the legs, feet, and all that. That's appendicular skeleton. So the first thing we talk about is the vertebral column. What is it? What are its parts? Is kind of, you see from the side, you see this like a front part, that's a body, and then you have this arch. Because you got the spinal cord going down. You got the extension of the brain going down through the spinal column. So you really want to protect that thing. And so you have it enclosed in bone, which is great until the bone grows internally and has arthritis, and then it pushes on it. And then that's when we sometimes need to take the back part of the bone. This here's the back part, the posterior part. If you touch yourself in the back, you feel these bumps. This is the bumps you feel, these spinous processes. And if somebody has bone growing in, like often in the lower back, you see people walk forward, stooped over. That could indicate that when they stand up straight, something pushes onto the spinal column, onto the nerve, the cord, and that of course creates pain and also dysfunction. The nerves can't fire as freely. And so what they do then is they cut these parts off here and they take the back part off and give it room in one segment or two segments. And so here are the parts. You got the transverse process comes out to the side. These are muscle attachments. From the body itself, you have these two bars. You can't see them that well here. These two bars coming up. They call that the pedicle. And then from the transverse backwards is the lamina. They call it the lamina, and then the spinous process. So you learn stuff like that and the parts. And then you also learn the unique features of the different parts of the spine. When you look at the spine, you have a neck portion that's called the cervical. You have a thoracic portion that's called, well, the mid-back is thoracic. That's where all the ribs attach. So you got a few more features where the ribs can attach. The ribs go into the spinal cord, into the spine, which is kind of interesting. They come from outside and then they enter, go into the spine. They attach two places on the spinal, on the transverse process, and then the rib head goes right in between two vertebrae and attaches in between two vertebrae. Between the vertebrae, we have the intervertebral disc. Inter means in between, vertebral is spine, and disc is sort of a cushy type material that actually displaces forces. It doesn't, get squeezed by itself. So that's a later topic. But it's interesting. And of course, I have no problem if somebody wants to talk more about it. We can talk on telephone, on Zoom all day long. It's my topic. I love this stuff. And then the low back is known as the lumbar spine, and we have a few unique features that happen in the lumbar spine, and so we'll talk about those. So we'll learn the spinal column. We learn as a generic vertebra, and then each section, the vertebrae look a little bit different, and so we go through those unique features. And then we have fused vertebrae together, and that's the lower part, the tailbone sort of thing behind when you hold your hands on the hip, in between those hips, that's the sacrum. That's its own, those are fused vertebrae. You can still see sort of the disc, and you can see some of the features like the transverse processes. They become the median sacral crest. It's just a different term. And then far below there, we have the coccyx, and the coccyx is the tailbone. Again, fused vertebra, but much more rudimentary than that. I mean, much more rudimentary than the sacrum. And then we get into the rib cage. And the rib cage is to do with the breastbone and then all the ribs. And we learn a little bit about these ribs. Most of those ribs are attached to the breastbone, the sternum, directly via cartilage. You see that here, still here. And that's at the first 7 are that. And then after that, we have some that are attached to the cartilage, but not directly to the breastbone, but through another ribs cartilage to the breastbone, and those are called the false ribs. For some reason, they're false. And then we at the bottom we have a couple that don't attach to anything; they're just sticking out, free floating. And this is important for the massage therapist. Make sure you don't scoop one up if you come from the side. Be careful about that. Or also people with scoliosis. Scoliosis is a pathology where your spine bends this way. If you look from the side, a spine should bend this way. The head goes forward, then the mid-back goes back a little, and the lower spine goes forward a little, and the sacrum actually goes back a little bit, but that's fused mostly. But from the front and the back, if you look, it should be straight, but sometimes it's not straight. Sometimes it's got a wiggle to it, and that wiggle is called a scoliosis. And I had a patient in her 80s with pretty bad scoliosis, and one time she came in and she's like, it really hurts right here when I walk for half a block. And we actually figured out that her bending on the spine was so bad that the floating rib was touching the hip. And that hurt because it was poking it. And so when I worked her, and with my, I do a lot of drop work where I bring a table up and then it jars it a little bit, and I push the bones around that way. And then we could straighten out this bone and the spine better. And for a while, she would be okay. And then slowly gravity takes over again, and we have to do it again. So that was an interesting learning experience for me. But, you don't read that in a textbook. You just have to learn the anatomy. I mean, I have to learn the anatomy and apply it as well as I can. Anyway, from there, then we move into the appendicular skeleton. And so those are all the bones of the upper and lower extremities. Oh God, it's already an hour over. Sorry. God, let me do 10 minutes and be done with that. And the upper extremity are, you know, the shoulder blade, the clavicle. We have different parts to that. We go into the upper arm. That's the humerus. The forearm is the radius and the ulna. If you look at the picture, you got these two bones that are parallel to each other, and they help actually with the palm up and palm down thing. They're pretty interesting. We have the same thing in the leg. And then I think we talked briefly a little bit about the hand, but I'm not going to make you learn all these carpal bones. This here's the wrist. The wrist means carpus from the first chapter. Remember that from the regional terms. And then we got the web of the palm. These are metacarpals. And then we got the fingers, and they call the fingers phalanges. So you learn a little bit about those. But again, I'm not going to make you study all of those different terms, just in general, those things there. And then the lower extremities start out with the pelvis. That pelvis is sort of a little bit like the shoulder blade and the clavicle together, the breast, the collarbone. Although it's all fused, and so it's much more stable. But, you know, you can see like this bar here is a little bit more the collarbone, because the collarbone kind of pushes the shoulder blade back so it stays in position there. It doesn't just come forward and cave in. It's actually a very weak bone. It's interesting. It's the most frequently broken bone in kids, because as soon as you fall down with an outstretched arm, that energy can go right into the collarbone and it can break it. It's a flat bone. If you've done the chapter on bones, on tissues, you know it's a flat bone, or you know what a flat bone is. It's not round. Blah, blah. And then we go into the thigh bone. We have parts of the thigh bone. We talk a little bit about the knee. And then from there, we go into the tibia and fibula. That's kind of like the forearm. It's got two bones to it. Although here they're weight bearing. So this bone is weight bearing, the big one, the tibia, and the fibula on the side is just kind of stabilizing. Not unimportant at all. Don't take it out, but it's not the weight bearing one. And then from there, we go into the foot, and the foot, instead of carpals in the ankle, we have tarsals. We got different tarsals. They have different names. I think I make you study the heel, the calcaneus, and the talus. And then the other ones are, you know, they're all kind of different names. They're all cuneiform, cuboid, navicular, really fine names. You know, navicular comes from boat, looks like a ship when you take it out. So that's kind of interesting terminology. But then instead of metacarpals here, we have metatarsals. That's the web of the foot. And then again, we have the phalanges in there. And so that is basically what this chapter talks about. And then from there, we go into muscle. First, we cover muscle function a little bit. Muscle function is basically muscle shortens, and everything else in here talks about how do the muscle shorten. So on this topic, I'm not going to go too much into here now, but I want you to listen to the lectures and read up on the bullet points, and that might be a topic where we can do this extra study together if some of you don't understand it fully or want to know more. It's a little bit tricky how that microscopic contraction of a muscle works, but it's really freaking cool once you get it. And so feel free to reach out to me, which actually I forgot to mention earlier. If you are interested in a study group, please reach out to me, because I have some people who sounded interesting, but we got to figure out how to coordinate it. If you can internally send each other messages or group message, then please take the initiative and do that. But I'm very happy to support you in that and do group texts on my end and help you with that. I did mention before under the home button, you have a Zoom room that's open all the time that you can go in and just meet up with each other. So you can do it virtually. You don't have to do it in person. And the other thing is I'm very willing and happy to also be part of the study groups. If you guys want to have info, so just shoot me a thing and hopefully I'm available, or we make it figure out how to be available, and then we're good. All right. So when we then go further in the next chapter, we talked about muscle origin. Muscle has different shapes. That's kind of cool. But you can work your way through that way yourself. We start then talking with the trunk muscles. And again, that's an axial musculature as in trunk. So we have muscles in the head, And the neck, we have muscles in the back that move the back around or stabilize the back. Then there we have different breathing muscles. Of course, the big one is the diaphragm, which is right underneath the rib cage, goes sort of inward and back. So it's actually a muscle that crosses the body, not goes lengthwise. Most muscles go lengthwise with the body, but we have some that cross. The diaphragm is one of those, and then the pelvic floor is one of those. And we sort of have in the chest, in the neck, we have a little bit of an outlet, but we don't have muscles that go straight through it. Anyway, that's the breathing. And then, of course, we talk about the six packs and etc. muscles as well a little bit, the different stomach muscles that hold all that together. Those are very important because the stomach content is liquid. And the more we compress that liquid, the more core strength we have. You guys all heard of core strength, I'm sure. And the more core strength we have, the more stable that midsection is of the body, and the easier and less wobbly, so to speak, everything comes out that we do in terms of motion. So we wobble less when we use the shoulder, so the shoulder wears out less and has more strength. And so that's where those muscles become interesting and important from a functional perspective, the stomach muscles. And then from there, we move into the upper extremities first. And we talk about, and this is where I organize the material in terms of what the different muscles do. So I have muscles that anchor the shoulder. So they anchor the shoulder blade, actually. These muscles go like, you know, from the shoulder blade to the chest on the inside. The serratus is that. When you see a boxer and you see these muscles that look like fingers on the side, or, you know, or a weightlifter or so, but the boxer shows it very clear because they push and that muscle is very strong in them. Though that muscle attaches from the shoulder blade to the chest and pulls the shoulder blade onto the chest. We got one in the front, for example, the pec minor, and that holds the shoulder blade and anchors it in from the front side. And so we have a few of those. We have a levator scapula, we have rhomboids. Levator scapula is here, levator scapula, if you look at the term, elevating the shoulder blade, elevating the scapula. So it's in the terminology what the muscle either does, and some point what the muscle attaches to, and some point what the muscle looks like. Like a rhomboid is looking like a rhomboid geometric figure, like the two parallel sides, but not in a right angle, so it's not a square. Otherwise, the muscle would be squaroid. Or trapezius, the muscle looks like a trapeze-shaped structure, geometric structure. So you get sort of these main ways that they describe muscles, or the serratus. Serratus comes from serrated knife, because when you look at the muscle here and you just look at where they attach, it looks like a jigsaw thing, and that's a serrated knife. And so that's when they figured out that muscle name. You got to think, you know, they're like somewhere in Rome under candlelight with a lot of wine, and then during the day coffee, like and they try to come up with these creative names of naming things. And so that's where it becomes a little mystical, to me at least. Anyway, that's the muscles that anchor the shoulder blade. Then we have muscles, they call them the rotator cuff muscles, and they anchor the arm into the shoulder blade. So I often tell my patients, like, the shoulder blade is anchored to the rib cage, and then the arm is attached to the shoulder blade. And the rotator cuffs are 4 muscles that attach the arm into the shoulder blade. So you learn about those a little bit. And so that becomes actually clinically important if you're a massage therapist, because you massage, you know, as a chiro, and I do a lot of body work and muscle work. I look at them that way, in that fashion. It's like when I look at the body, it's like, well, which joint's not looking right, or not feeling right, or not moving right? And then I'm like, well, which muscle would do that? And then I'm like, well, maybe there's an involvement in that muscle group. And so, so that's the sits. The sits comes from the first letter of the different names is supraspinatus, infraspinatus, teres minor, and subscapularis. So that's why that is there. They use it sort of as a mnemonic. And then from there, we go and look at muscles that move the upper arm about. And a lot of the muscles that move the upper arm are attached to the shoulder blade, or also the chest, like the pecs or the latissimus, the latissimus dorsi in the back. In the booklet, I have a picture of Michael Phelps. That thing is like huge on this guy. And everybody else who's also in the Olympics is like a little boy next to him. It's very interesting, that picture. You probably have it in the video too, because the video are based on the booklets. And so we have these muscles that move the upper arm around. Then we have muscles that move the elbow around. Those muscles are mostly in the front of the arm or the back of the arm. So the elbow movers they're always more proximal. So the elbow movers are in the arm, and then the wrist movers are in the forearm. And so we do muscles in that fashion. Good, so that's for that. And then last chapter we have is the lower extremities. And again, similarly organized, who moves what around. So we got hip movers that work on the hip. Those are, for example, the movers, you know, the piriformis that moves up on the hip, that actually turns the foot in and out. That's one of those one of the muscles that does that. It's attached to the sacrum and then the outside of the hip. But then moving this stuff around, we have a lot of the glutes are attached here, and et cetera, et cetera. I see the glute max. Then the tensor fasciae latae is one in the front that goes into the thigh, but moves that hip joint around. And then as a second group, we have the knee movers, and the knee movers are attached here. Those are the hamstrings, for example, in the back, or we have the quads in the front that move it around. Or no, the adductors, the ones up here that move the thigh inward, that's more into the hip movers, I believe. Should be. Oh no, look, I have it down here. It gets a little bit goofy. I don't know. Maybe I change that next time. And then lastly, we have the ankle movers, and the ankle movers are in the calf. So if you look at the back of the calf, the thick ones, those move the ankle up and down. So if you stand on your tiptoes, these muscles contract because they have to lift the heel up. And we have a multitude of those muscles. We have a few compartments. We have muscles in the front. When you look right next to your shin, that muscle bulge, those muscles go here to the ankle and then also to the toes. And they bring the toes up. They help in dorsiflexion, for example. Then we have a compartment that's on the outside. See, there wasn't a picture, but I have all the cadavers. And you can Google a lot of these pictures, or look at, if you look at the video and you just screenshot it where it's right at or something, you can also get those, or of course, in the booklets, my dear little booklets. That's my art piece, my booklets. I'm proud of it. That's done so much work to do that stuff. But then anyway, we have the posterior compartment is here deep underneath the top layer. There is a deeper layer where again these muscles then go to the ankle and some go to the toe, and they help with pushing the foot downward, the plantar flexion. Good. These lateral compartments muscles, see, these muscles are all fibularis. They're attached to the fibula. The older name is peroneus muscle, and these are the ones that fire up really heavy if you twist your ankle. And so that's, if you have that problem, you want to talk more about it, let me know, because there's some cool stuff you can do on your own to help that. All right, and I think that's it from the material for this week. It's definitely plenty. And then of course, everything has a questionnaire with it and everything has labeling with it. And that's mostly the work that you have to do this week. Are there any questions?
That sounds pretty clear.
I know it's a little much, right? I'm just
Professor, I did have a question regarding some of the assignments.
Mm-hmm.
So for example, I started with the labeling and coloring for the skull diagrams.
Mm-hmm.
And you gave us the terms in the list. We're only supposed to use them once.
Yes.
Ignore the lines that are possibly already there, that I understand. I was just wondering, as far as grading goes, or being able to identify that we did it, there's some parts like the sagittal suture, right? There's no based on the diagrams that we were provided, something like the sagittal suture is not so clear for us to be like, it's right there. So can we just
you can just
pretend to be
you can just improvise. Yeah. When I make these, when I made these exercises, they are, I go to Google and I find the best images, and actually, see, this is one that's a little hard. So you just draw it in there, for example.
Or we could, and same for like sphenoid and ethmoid bones, like there's no clear butterfly picture for me to be like greater wings, lesser wings.
No, I get it. You just do the best you can.
Okay. Okay,
and you visualize. And because on these, I do a lot of spot grading on these, completion and
Okay.
spot grading, because I provide you a lot of the videos that indicating and show it, and you can really get an understanding of that. And so be creative as
Okay.
creative as you want.
Okay.
I mean, I have students that make flashcards, and they send me a picture of their flashcards. That way they already created their thing, and instead of doing a homework that, you know, they just make their flashcards instead of doing the sheet, and then they have that created. You could do that too.
Oh, okay, gotcha.
I encourage your creativity.
Okay,
You know, it's all about, especially in a fast class like that. If you know how you study and how you retain info, go for it. Talk to me about it. Do those things. If it just turns out you don't want to do the work, I'll figure that out. Don't worry about it.
okay, great,
That's not
thanks.
a problem. You know, it's really about, you know, try to find, back to Robinson, you know, try to find your creative interests of how you like to do it. And then that will make it much more curious instead of just being mindless work. And some people, you know, for some people it's fine, but some people it's hard to do something that is not.
Okay.
You know.
I just, that works, because there is some, for me, I felt that I'm like, well, that's kind of technically behind this one. So there's like arrows that are coming from the same area, but
Right.
I was just trying to figure out how. I was
No, I'm
gonna-
very glad you bring it up, because I keep forgetting to mention those things. The same with like, ignore the lines, because they are just there. And for me, I can't just take them all out. It just was too much to do, or it bastardized the picture too much. That I got basically from the internet ultimately, you know, and
Right.
then just look around. And over
Okay.
the years, they gotten better and better. And so maybe if I do it again, I have better ones around. Also, you know, if you want to indicate a term more than once, that's totally fine. If it helps your learning,
Okay,
you don't have to. You know, if it doesn't help your learning, if you don't think so, you get it, then just do it that way. Or if you want to do the muscles and, you know, you want to do the cutouts and then make flashcards and then write down the origin insertion, so then that's your homework. I'm totally fine with that. All right. Anybody else? No? Well, if not, we can stop it here. I wish you all a wonderful week. I'm going to stay around. So please, if you feel like you have individual questions, stick around. Other than that, unless I hear from you via text or any other means, I assume everything is good.
Thank you.
Thank you, guys. Stay in touch.
actually, Professor, sorry, I
Thank
had just one
you.
more comment.